Right, the constant rubbing or a bathing of limbs and things, and this towel bath is a very good thing to do for those types of individuals. It gives them a clean kind of feeling, and believe it or not knowing, see, because I didn't have this in my textbook about the towel bath. But it's actually a preferred method for especially those that are have acute kinds of conditions like the COPDers. That's just a picture. I couldn't find an adult that those are kids with towels around. That's depicted there.
So when we do the bed bath once,
No, you're not going to do in the nursing home. They like to get those patients up in the shower room. See. In the ICU, you might see where they do the towel bath. Most hospitals, unless they're on bed rest, you'll assist them up into the shower. But the nursing homes, I tell you, they want them up into the shower rooms. I will tell you that. It has to be somebody that is non-responsive that they would have you do the bed bath. And most, there might be one or two in the nursing homes that are in that situation, and that's why I speak of the hospice kind of person or patient. But for the most part, you get them up to the showers. My group, you're getting your patients, you're getting the residents up to the showers. I will tell you, Autumn Winds, they want all their patients in the shower. Makes them feel good, right? They have these pre-packaged baths in a bag, and they'll actually have these little warmers. And you'll see these in the hospitals. You won't see these in the nursing home, but you see them in the hospitals. Who works in a hospital here? Anybody? Anybody working in a hospital? At the VA. Did you ever see these little bath in a bag? Because they would have them at BAMC.
We have them.
You know, and they have this little warming, like a little oven thing, and you can pull them out. They got these little slots, and they also
come in a
have,
package just like that. Because when I had surgery,
yes,
they had
and they just pull that out, and there's about 8 in the package,
Yeah.
right? And they're very soft, but they're not very good if you don't have them warmed. I will tell you, they're not very soothing.
You can even microwave them now.
You can microwave them. Don't over microwave them, right? These things get hot fast.
Sometimes they have heaters for it.
That's the heater. That's what I was saying. They got the little heater, and they have these little slots, and you can pull out the. See, they have them, and as you use, you replace. And that's really what I've seen. These companies, they provide the little oven heaters, and they got shower caps too, made by the company. And those are nice, and you just put them on, and you just massage your head, and you don't. These aren't washable. You don't have to wash off. It's like a no soap kind of a deal. They cost money though. Few
Nice.
reminders: warm, not hot water. Don't chill the patient. Make sure you have bath blankets. Typically, those shower rooms, they keep them pretty warm. Try not to tire out your patient. You have the ICU patient, you sometimes got to do them in segments. But remember, at the nursing home, that is their home. Their home, they should be pretty much, for the most part, able to handle the shower. Then rest them. And then just say, now, after we get back, I'm going to help you get into your clothing. And then maybe if you want to rest for about 15 minutes, and then I'll come back and I'll want to, if it's okay, I might want to take your vital signs. See how y'all want to do it? Y'all pick the patient that y'all showered, and that's why y'all gonna be working closely and helping those CNAs, right? Because they're gonna help you, and you're gonna help them. See how that makes sense? You're gonna be able to get your assessments done. Same principle, just like you do a head-to-toe assessment, right? You bathe, and this would be of course the clean. This right there. It's just common sense. Common sense. If you were doing a bed bath and it got dirty or cold, you change it, right? That's just common sense, right? I didn't really, in my skills lab, I didn't bring up about restraints to you. You know why I didn't really, you know why I didn't talk about or make you play with restraints? Anybody? Do you see them?
Getting away from them.
Try not to.
Yes. I mean, where you're going to see restraints is in an ICU when they put an endotracheal tube in. They can teach you then. That's at the tail end of your program. But used to be years ago, except for Dawn, you tell them about your situation. But years ago, that's you walk into a nursing home and they'd all be lined up on either side of the nursing station in these jerry chairs, and they'd have these posy vests tied every which way to Sunday, and they'd just be tied into those chairs for the day. That was the routine. That was what we thought we're supposed to do. That's not right, is it? That's wrong. We don't do prisoners that way. Well, I mean, we do, but I mean, you know, but once they get into their prison, then they're not tied down like that, right? Unless they're getting executed, then they get strapped down. But I mean, that's basically what we're doing. We're strapping them down. Wow, this thing's going to go viral, isn't it? Oh, well. It's true. We don't want to do these things. Yes?
Says on the towel that the babe from feet working towards the head.
Well, we're going to have different towels, aren't we?
Yeah, do so.
We're going to have layers of towels.
For the towel bath?
Oh, yes. Oh, yes. You're going to have, because, you know, these towels aren't so big. They're not like the beach towels we have. You know, you're going to have several towels. You're not going to use that towel that you had at the feet on the face, are you? Nah.
No.
You're going to use several
I'm
towels.
just saying because it says right there. Head,
Well, I'm talking about in terms of, you got me there. You got me there on the descriptive there. But you got to imagine a normal bath. If we use the little hand mitten, we go head to toe. It's the same, and I'm just trying to give you an analogy, a concept. When you get up in the morning, you don't bathe your feet, do you, and then go to your face?
Yeah. I'm just wondering why it said it backwards.
It's probably dealing with the circulation kind of thing, returning that blood flow to the heart. Maybe that's it. To be honest, as a nurse, I did the head to toe thing. I have no idea why it's
Sounds
that
better
way.
to me.
It just, you know, do things that make sense to you. You know, I can't always promise everything that you have in these books is the honest to God correct thing. Because remember, that's a nurse that writes that, and she's had her experiences, I've had my experiences. You'll have your experiences. You do what makes sense and works for you as long as it's appropriate for the promotion of your care of your patient. That's what I say. But just think common sense, guys. Common sense.
Where does it say that? About the
He's found
Towel
the
bath
case.
391. Volume 391.
Yeah. He's really tearing these books up. That's good.
I just have
Proud of you. Proud of you.
I could have sworn volume 1 it says.
See? Huh?
Yeah, volume 1 says head to toe.
Volume 1 says head to toe, and volume 2 says toe to head. Isn't that something? See, I didn't write the books. I don't get these royalties. Maybe I should.
Yeah, it doesn't give an explanation. It just says.
I'm just trying to think maybe circulation. I don't know. Return the blood flow. I have no idea. I wouldn't do it that way personally. I just follow the concept of head to toe. It just makes sense. Because that's what you do. That's how we make ourselves. Pericare. And what I've given you here on this slide is depicting the illustration of maybe this is a female. And what the nursing assistant's done, she's placed her on a bedpan. And then I said, a nice touch is to introduce the concept of a peri bottle. You have this, you'll see this on the OB floors. But it doesn't hurt if you're in the hospital on the med-surg floors. You can say, can I get a peri bottle for my patient, and if they're not able to get up out of bed. You see, if they're on bed rest, if they're not on bed rest, that's a different story, you don't need this. This person must be on bed rest. To spray warm water in the peri area, it's cleansing, and it goes right into the bedpan. Do you see how that makes sense? You know, because down there it just gets sort of, you know, it's where bacteria likes to come because it's dark and warm, right? Get moist, see? There you go. Somebody that's got a GI bleed, keep in mind they're going to need more frequent perineal care. That's male or female. GI bleed. GI bleeds have they're usually a lot of times they're incontinent. They're on bed rest because they're bleeding. They're actively bleeding, and it's sticky. You know, blood is sort of a sticky kind of substance. So you want to give good peri care. Not that you get the male the peri bottle. I'm just saying that's for the perineal for the female. But I'm saying just remember to give good peri care and follow up. My father-in-law was in the hospital a couple of years back, and he was in for a GI bleed, and he reported that they hadn't even once brought him a bath basin to him. Now, I'm sure when he was incontinent in school, they did a real quick swipe. You know what I'm saying? But can you imagine? He was in the hospital for about 3 weeks, I think. And my husband drove up there, and he called me and said, now he's a musician, you know. He doesn't have any medical, but he's married to me. You know, but he does have some common sense. That's what my husband, he's just a high school degree that never went to college, but he's got common sense. He says, do you think that it's right that they haven't shaved my dad? And I said, no, you demand to see that house officer and tell them that they're not providing care. And boy, did he do a firestorm. And then he did the firestorm, and they still didn't do it. And he called me back. That same shift, they should have done something. Because when he called me back, and he told me they didn't do it, you know what I did? I found who is in charge of this hospital system, this regional. You know, it's not just the hospital. I study this. I say, who's that CEO that's over the regional hospitals? I say, there's a problem here. Something wrong with this picture. And I like to use details. But they made sure every day he had a visit from the nurse unit manager and whoever the hospital house officer was for that shift, for the different shifts, to make sure everything was going just so. But see, it shouldn't have been, because see, nobody else, they come and visit, they go. And then the father doesn't say nothing. See what I'm saying? And that's what happens to our elderly. They don't feel like they have a right to say. They're sort of embarrassed. It's embarrassing to say, well, could you clean me up? I mean, that shouldn't even have to happen. That's just a no-brainer. But I'm sorry to say that kind of stuff goes on. So I love that I get the hygiene chapter because I'm drilling it in y'all's head. That's part of your responsibility. You make sure each and every one of your patients has meticulous hygiene and oral care and peri-care and their beds clean and their rooms neat and just so. And they all, as long as it's not contraindicated, they want ice water, fresh water at their bedside. And their bedside table's cleaned off. Something that's overlooked is people will not wash down their bedside table. People don't do it. I don't know why. But that's part of, at the end of the bath, after everything's done and everything's put up, that's the last thing that should be washed down is that bedside table that you use. Because then you know at least once a day, at least while you're working, that bedside table was clean. I mean, you don't go to a restaurant and expect to eat off somebody's table that they just ate, you know. You see what I'm going with that, right? It's only fair. And you know, the hospital's got so many germs, right? Again, talking about different assessments. This is talking about assessment of the feet. When you guys are in there in the showers, you're going to be able to see their skin, just see how you, doesn't it make sense what I'm telling you to do? You'll want to all do your baths, won't you? When you're in practice. That's why I love working ICU, because I did my baths. I didn't have anybody to delegate to. It was just me. I was my RN, LVN, CNA, and unit secretary. Because they'd pull my unit secretary, so I'd have to take my own orders off. You know, that's okay. It's good to know all the jobs, because then you can function. Woe to the RN that does not know how to give a bath or get a person up into a wheelchair. Woe to them. They shouldn't be a nurse. Do y'all concur?
Concur.
Woe to the one that doesn't know how to do a manual blood pressure. Don't y'all dare forget. Oh, whoa. That cardiologist. He doesn't like those digital roly-poly machines. He wants a manual blood pressure. And you got to go get it. And you better get it right now. You got 1 minute to get it. That's what it is. But I'll tell you, some nurses, they get away from thinking that they have to do it, and they don't do it, and guess what? If you don't use it, you lose the skill. That's why I'll say, if you guys need me to help you, I'll be there to help you. I'm going to walk around, make sure everybody's doing okay, but I got to let y'all have your learning experience. But if you did need me, I'll come and help you with the bath. But should. But I don't mind. See, that's what I'm saying. I don't mind because I enjoy it. It allows me to have my time with patients. That's why I like teaching, because, you know, I know that I can assign these students to give this excellent care to these seniors that deserve it. See, they don't be rushed through. Because at this moment in time, you guys are just being assigned. You'll just be doing one at a time. You're not assigned to a whole floor, are you? And you just have to do care plan on one resident, say. Charting on one resident you pick out of all that you shower tomorrow. Because you might shower multiple people, but you pick one of those that you'll decide to do your assessment, you know, your note and your care plan on. You see how that works. But you get the essence of it. You learn these basics. Because if you can do that, for sure you'll know how to take care of a patient in ICU, on a ventilator, on these drips, on the balloon pump. You see? But if you can't do those basics, you have no business being a nurse. No business. Okay. I must move on. Here's that. I was just giving y'all some examples of some foot problems that you might see. Ingrown toenail. I have a slight ingrown toenail. I cut my nails too short. We will not cut nails in the nursing home. You guys, if you can think about it, y'all bring me some files, some nail files. Please, my group. I will allow you to file nails, but I won't allow you to cut nails. We avoid that because we can have individual patients that's got diabetes, and we might cut it to the quick and cause infection, and infection leads to the demise of a digit amputation. I will only allow filing, but you may soak them. See, I allow you to soak them in a basin. Y'all can do nail care, soak their hands.
Not the diabetic.
No, I don't allow you to clip their nails. Soak them.
I read, yeah.
Soak.
Yeah,
We're not
give
supposed to
it-
soak
that's when we learn how to do the bath. They say
come
don't
on,
soak
guys. Wash people's hands. Let them feel good. You're gonna.
No, the book says not to soak.
So not the
Diabetics.
Well,
I don't know why.
for how long?
It doesn't say why.
I mean, can't you put
Oh, it
your
just says don't do it.
residents' hands in a a basin of water. I mean, do they wash their hands? Do they not wash their hands?
Yeah.
We're talking about soaking them.
Well, I'm not saying extended periods of times till they're wrinkled and, no, come on, guys. So, does it hurt to let someone have their hands in a basin of warm water for a couple minutes? I mean, come on, let's think what feels good. That's not gonna hurt them.
Yeah, it doesn't say why. Sometimes they'll give
Yeah,
explanation.
but what I'm trying to, I know, but you gotta understand, your mom's a diabetic. She has been put in a nursing home.
Yeah.
She's someone that enjoyed going to get her nails done.
Oh, no.
But we're not, no, I want you gotta get this picture. But you're not gonna let her soak her hands for a couple minutes in a basin because she's diabetic.
No, it says, the book just says.
No, I gotta make sure. I gotta make sure you understand that you've got to give care.
Oh, I understand, I gotta be
Would that
careful.
be if they have a sore, maybe? You know, that sometimes that is, have sore?
Yeah, but
He said it
look
doesn't
now,
say
guys,
it.
let's, with some, see, that textbook now, what I'm trying to say is we gotta give care. I'm saying don't cut their nails. Whether they're diabetic or not, we're not gonna cut nails, but file nails, that's appropriate. They might have their own nail polish, but they're so frail. Because you know what you do, a couple minutes soaking them in the basin. Isn't that what they do at the Walmart nail place? I mean, I don't go. I've never been. Not Ron hasn't either, so we don't know really. So we don't know. There's some of you that do go to these nail places.
Probably has.
No,
The wife's trying to get me to go, it ain't happening.
no, don't do it. But some of y'all have gone and had your nails, right? Who has in here gone and had your nails done? Don't they soak them for a couple minutes in
Yeah,
some?
I think they do just, when you
And
go
they
there,
just
they
say-
ask if you're diabetic. They have a sign posted
But
when you
don't
go.
they do this? Don't they? I've seen them.
Yeah. They just take special care for people that's with diabetics.
Yes, they will be very careful because they do trim. I've seen them, but we don't trim. No, say this out loud, guys. We don't trim.
We don't trim.
We will, and so I recommend that you bring you some files. Don't use them on different patients. You know, one file goes to one patient,
Well, they
right?
ain't getting no files. No.
I know the book might say you can't have files, right?
No, said I ain't gonna buy a whole bunch for no.
Yeah, but do you see what I mean? Whatever patient you file, that's their dedicated file. And you could always say, now I'm gonna put this in this top drawer because when I come back next week, I'll look and see how your nails look. See if they need another filing when I come back next week. But you don't use one file for the whole lot, so you wouldn't do that, would you? It's a dedicated file, just like a hairbrush, right? Ryan, you missed that. Dedicated file, you know, for,
One patient, one file.
that's it.
Right.
You know, that's it. He's in my group. They might enjoy some nail polish. They might have it in their top drawer and they don't have really, and that was given to them by maybe some family member mailed it in to them as a Christmas gift. And there it sits. There it sits because why? They're too feeble, too shaky to put it on. But you all can offer and ask, and see, that's the kind of thing I want to see when I want y'all to be with your patients. It shouldn't take but just no more than 15 minutes to skim through that chart on the way out as we go back to the school for our post-conference. I'm more about seeing what you do with working with your patients and enjoying that time. It's the essence of nursing, you know. That's what fundamentals is about. Can you do these basic foundational things? And all you have to think of is you got to think, that's my mom or that's my dad. And you know you're going to do the right thing. You know you will.
You do anything for cows?
calluses, we would defer that to the nurse to call the doctor to get a consult. Now, say you come across something like that. Wow. Do you think that I've come across that in the ICU? I admit this patient and I'm doing my head-to-toe assessment? No. Oh, yes. They get admitted. They come in like that. They come in like that. Oh, yes. Oh, yes, indeed. How do you think they get these illustrations? How do you think we get these pictures? Because this is an elderly patient that's not had anybody to care for them.
How do you start on that?
You don't. You don't. Your first thing is you go out to that station and you call Dr. Moore. I have your patient here, Terry Moore, which not no relation. And they have to have a podiatrist. You have to call in a podiatrist. Oh, okay, thank you. I don't know how many times in the ICU we admit patients from their home. They come in code 3 through the ER, and they're in lax. Sometimes they do a focused assessment because why? They come in septic. You can imagine that this, you see that skin change? You see that, don't you? Yeah. That's, I call it atrophic skin changes, but basically it's a vascular issue, isn't it? Y'all see that? That shiny red skin. Do you see it? It has little hair to it. If if it had the legs, there would be scant hair, wouldn't it? You guys probably had that. Didn't y'all have the discussion of that on the last?
Yeah.
Yes.
This is an illustration of what can happen. Poor vascular problems, and then poor health and lack of any family interest, unfortunately. Yes?
I had a patient that had feet like that with, really dry. Could you put lotion on their feet?
Yes.
Or is
Yes.
that vascular, wouldn't wanna...
You could put some Eucerin. They would order Eucerin, or they actually have some skin barrier type ointments that the nursing homes subscribe to. But you have to call that doctor.
What would the doctor do?
He would get a podiatrist in.
What is the diet?
Oh, they have tools. They bring their own. I tell you, they got a suitcase. They got a suitcase, and they follow that patient. They may follow that patient for several weeks. They can trim. They have to come back in segments to do this. I've had patients in that shape, and it would be visits. It would be visits that they would have to do to try to get this straightened out. Yeah, but well, they're 78 years old, and for the past 20 years, they've not had any family member that's attended to them properly. And the doctor doesn't. I mean, tell me how many times a doctor takes off those socks in the doctor's office. And the patient doesn't say anything because they're too embarrassed. See, that's what happens. They just coming in to be checked because the heart, it's that time. It's every 6 months to do a checkup, right? But we don't bother doing the head. You see what I'm saying? Yeah. What do? They pop the stethoscope, boom, boom, and, that's about it. You know what I'm saying. You guys that go on and be nurse practitioners here, I love this chapter, isn't it? It's a lot to talk about. You guys that are going to get your BSN, and then you're going to go on and be nurse practitioner, and I'll write you a letter of recommendation to whatever school you go to, right? Because then I'm going to say, now when you get your nurse practitioner, I've got your first patient. It'll be Terry Moore, my husband. You handle it.
I got enough stories, but it's not as gross as the other one.
Okay, she's got a story. Is it dealing with nails?
Dealing with nails.
Okay, listen up. She's probably experienced
I
this.
had an aunt that lived here in San Antonio that was with a significant other that secluded her. And one day I got a call saying that she was at Baptist Hospital and they needed somebody to care for her.